Well, that's of course a very, very broad topic, but I think what is really important for an individual who has a DSD condition is that we look at the whole person, at the family, that we don't only take care of the pure medical aspects of the condition, but also we should focus on quality of life, well-being, resilience, helping them actually to understand their condition. So early information is very important. And of course you cannot do this alone as a pediatric endocrinologist, but you need a whole team for that, including a psychologist, geneticists very often, also people from the ethics department are needed. And of course there's also the surgeon and the gynecologist who can help us, but the team is really very large. Well, outcome studies have shown that many individuals with DSD conditions have suboptimal outcomes, and we have learned from this that a management that was maybe too much focused on the pure medical aspects or even surgical aspects are not the best ones to have optimal outcomes. So what these individuals really need is doctors who care for them, for their families also, increase acceptance of the condition, increase resilience to live with these conditions, because these people are not ill, but they have to deal with a number of issues for which they need information and support. The Council of Europe has pronounced a recommendation against early genital surgery in children who have a DSD condition without their informed consent. And I think that is very important, but what the European Union actually has forgotten is that something needs to be there in place. And so we really need to focus on this psychosocial support aspect, and it should be very important that there would also be recommendations on how to build teams, on how to refer patients to these expert teams so that they get the best holistic care possible. And that's something that is currently lacking in many countries, I think. So what I think is very important for the future is that we all work together all over Europe and all over the world actually in collecting all the similar outcome data, so that as soon as possible we know that the current approach that we are promoting now really has better results. And if we all do it our way, collecting data in an individual fashion, then this will not lead to the large numbers and comparable data that we need. So we really need to work together in parallel and try to collect together as much as outcome data possible.